You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum. This is Back at It with Dr. Decompression. Welcome. I'm Dr. Dudum. This is the Back at It podcast with Dr. Decompression, episode number 26. Wow, we're getting up there with episodes. Hey, I want to talk about one more thing. One more thing you can do, or one more thing you should try, and to not give up. Okay, low back pain doesn't have to be forever. You can get past this. Just don't give up. Try one more thing. That's the thesis or the theme of today. Before I dive in, I want to thank our sponsors, Pillowise USA, for their custom pillows. And then I want to thank PowerPlate Technology and the power plates that we use to strengthen our backs for our patients. So both of those companies, huge supporters of the podcast and what I do with patients. So shout out to them, check them out, and check out the products. So one more thing. If you've ever tried something and it didn't work, and you're like, hey, that doesn't work, I don't want to do that, it's not going to work. Maybe you have to try it in a different way or a different manner. So let's say you want to lose weight and, I want to lose 10 pounds. I'm going to go vegan. Vegan's going to be the way. And gosh, you're trying to lose weight and you go vegan and it worked for someone but it didn't work for you. That's okay. You know what? You got to stop trying going vegan, or maybe you have to add different things, or maybe you have to go completely opposite and go paleo. You have to try different things. You could try paleo and you could lose 10 pounds instantly. So be open to trying new things. Don't give up. Okay, so let's look at an example with physical therapy, for example. You go to a physical therapist and it's not working. Okay, what you don't want to do, you don't want to go to another physical therapist that does the same thing in the same exact way, in the same analysis. You would maybe explore physical therapy from a different perspective. Maybe it's muscle activation or more brain-based therapy. Try something, maybe another physical therapist, but in a different direction, a different strategy. Or maybe that therapist unlocks something that the other one didn't, right? So look for different things. Let's dive into decompression. How does that work for decompression? And the reason I want to talk about this episode is I see this all the time in my clinic, my decompression clinic, where a patient says, hey, I've heard it doesn't work, right? It doesn't work. Or, I tried it, it didn't work for me. Okay. Here's an example I'm going to use with a patient. This happened last week in the office. I'm bringing this podcast because I want to give you real life clinical patient examples of what we do and why and how I do it. Speaking with a patient, they've tried decompression before. They have an L4, L5 extruded disc. So for the listeners, I'm sorry, I'll describe it, but for the video, for you watching on YouTube, check this out. They have a disc injury right there. The disc is between the two bones there. There's the disc. Now think about this. There's pressure, and this disc, that red, is the extruded fragment that's now up into the spinal cord on the nerve. They've got really bad pain into their left leg from the nerve. It's an L4, L5. It's an 8-millimeter disc extrusion. Very big. Surgical candidate. Tried everything, even tried decompression. I saw on their MRI that they had what's called an anterior lethesis. I've talked about a spondylolisthesis or an anterior lethesis or a spondy before. Let's recap real quick so we're on the same page. Two bones, this is the front, this is the back. It's the top bone is slipped forward relative to the bone below. It could be a quarter inch, it could be a centimeter, it could be 2 centimeters, would be very big. Most common is about a quarter inch to a centimeter. It's big, but common for what I see. And I saw the report and I said, I wonder if this patient has joint instability, if the ligaments that hold those bones or joints in place are those ligaments tired? Are they stretched out? Do they not have the strengthening capability to hold that joint in place? Because if that is going on, guys, it would totally shift my strategy for how I would help them. So, question, has anyone, and how would you check joint instability? Well, you would take a flexion extension film and you would notice if the joint, when you're leaning forward and backwards, if the joint really slides forward or really slides backwards, the ligaments aren't strong enough to hold it. So that would completely change my strategy for spinal decompression, completely change it. And I need to know that going into a case, if there is a structural misalignment like an anterior or a spondy. So when I saw the patient's MRI, I noticed an anterior at L4, L5, the same level where the disc herniation is. Now, in spinal decompression, the training is typically, hey, you have an L4, L5 disc herniation or extruded fragment. That's causing your pain through specific orthopedic testing. And the dermatomes are the patterns in the leg that the referring nerve pain is going to. It's pretty classic. It's pretty black and white. Let's attack the L4, L5 disc and let's pull apart, right? And let's oscillate. If you're doing that and it's causing more pain or you're not responding, it may be that spinal decompression is not right for you. That is possible. Okay, that's possible. It's possible. However, go one step further. Try one more thing. That's all I'm asking you to do is try one more thing. Speaking of this patient, hey, let's take you have a spondy. Let's take some flexion extension films. Because if you do, that would totally shift the angle I'm going to pull you at. And it would actually justify and make sense why you were not responding to the decompression care. And it would make sense why you were actually getting a little flared up. So I think it could still work. Let's just take a film and see if my brain and my experience, if I think I could help you. Patient agreed, came in, we took a flexion extension film. Wow, did you notice that on that film, the joint slid a little bit forward? There was movement in that joint. The ligaments that were think of the ligaments. The ligaments, the supporting tissue, they're like rubber bands, okay? They should be very taut and not very elastic. That would not be good. Think if you've had an ankle injury. If you've had for me personally, playing basketball, I've had so many ankle sprains on both ankles. Like, which ankle's your worst? They both suck. So if you play sports, basketball, anything where you sprain your ankle multiple times, if you're listening, you're laughing because you know what I'm talking about. My ankles are so loose, there is no stability in my ankle. It's similar, it's kind of similar concept to your lower back. If you have an injury like a car accident or any fall, a cheerleading or volleyball or any type of falling off a ladder or a horse, those ligaments could be a little stretched, similar to my ankles, okay? And if that's the case, if I were to pull you, in this particular patient, if I pulled you at L4, L5 for your disc extrusion with a bunch of weight, you would not do well. I could tell you right now, 99.9% you wouldn't do well. So you're thinking, well, can I still help this patient? I may be able to still help this patient. One more thing to try. What would I do? What would we do? If there is instability, I have to change the angle. I can't attack the actual disc extrusion. I have to use different forces and possibly lay the patient flat on the table because I don't want the L4 slipping and sliding in there. That would not be good. That would cause a possible flare-up. That's why this patient got worse. So check this out. 2 weeks into treatment, do the flexion extension films, identify the joint instability. Number two, what we're going to do is we're going to pull appropriately based on the joint instability. Change the angle. 2 weeks later, this patient's leg pain is 60% better. From changing the angle, knowing what's the root cause of the problem, which is the instability, and changing the angle and pulling flat. Just try one more thing is all you have to do. Don't give up. There are solutions. If it's not working, give it a fair shot. And if not, try something different. But try to find someone that's going to look at things from a different perspective before you give up on that treatment or modality. Just like going vegan might not be right for you, but dieting could be right for you. Just like physical therapy. If you're trying a physical therapist and it's not working, it might not be physical therapy. It might just be you need someone that's going to have a different mental approach to help you and identify a different root cause. And lastly, if you've tried decompression and it didn't work, let's talk and see if there's anything that maybe we should change based on different data and based on the root cause. Not forcing decompression, but let's see if there's something else that could help before we do more, how do I say this? Drugs and injections and surgeries. Let's try that. So again, try one more thing before you give up. Don't give up. That's the pod today. It's more of a motivational and educational episode. Thank you to the sponsors, PillowWise and PowerPlate USA, again, for bringing this content to you. And next episode, next week, I'll be dropping another clinical episode with Dr. Cam, and we're actually going to talk about joint instability in much more detail than today. So if you're curious about that, don't forget to subscribe to the pod. And then you can find us on YouTube, subscribe to our channel so you can find out up-to-date drops on the podcast. I'm Dr. Dudum. This is Back at It with Dr. Decompression. Thanks for watching.